Dear President Trump,
we know there are many issues waiting for you in Congress when you come into office,
but we feel like the most urgent issue for you to deal with is the Patient Protection and Affordable Care Act, also known as ObamaCare.
In 2010, Barack Obama passed the Patient Protection and Affordable Care Act, also known as ObamaCare.
This was created to make healthcare more affordable and to improve the quality while creating more strict regulations on health insurance companies and the industry.
Tax credits are provided to America's poorest, from small employers to those who need help paying for insurance.
Today, about 20 million people are enrolled in Obamacare out of the 325 million people in the country.
Today, the uninsured rate is at an all-time low of 11.9%.
The term affordable should mean affordable, like it says, and I think that for a lot of people, for most people, it's not affordable. I think it's a misconception to say that everyone can have health care now, but really, is that true when they can't afford it?
The thing I don't like about Obamacare is that it forces people to buy insurance, and if you are middle class and not making enough money to pay for it, you get penalized with another fee. So I think the cost of it and taking into consideration what people make is not fair.
Well, I feel like it sounds good in theory, but it takes money from the people that are paying insurance and gives it to the lower class, so really the government's not paying for it. I am.
There's a thing from Ronald Reagan that he said, I think it's the 9 worst words: I'm from the government, I'm here to help. Anytime I hear government's going to step in, usually drives the cost up. A good example is a local businessman. Him and his wife and 1 child. His insurance is going to go up from $700 to $1,200 next year.
I think it's unfair that people are being forced to have that kind of insurance, and it's overpriced for anybody, which is not fair in what it was supposed to be.
Obamacare has been a complete failure because not even the poor can afford Obamacare. You see, they're making minimum wage and they're required to have Obamacare. They can't even afford it. It takes away their money and it takes away my money.
Although young people are generally healthy and don't need as much coverage as older Americans, they have some of the best benefits and coverage when being compared to everyone else under the ACA. This makes it harder for people who really need health care to get it, causing the plan to be very expensive for certain people. Americans who just miss the federal poverty limit are hit the hardest with the ACA because they don't qualify for the assistance that is given.
They have diabetes, they have a doctor that's taking care of them, the doctor doesn't take any of the claims. They can't even pay the doctor cash to see them.
The Congressional Budget Office estimates that the ACA will cost about $1.34 trillion over the next decade. That's $110 billion in 2016 alone. To pay for this, there are many new taxes, and many of these taxes are placed on high earners as well as on the healthcare industry. Patients of offices also get dropped from their plans for not visiting their doctor enough, which causes major issues when an illness arises.
Insurance. The same law that encouraged people to sign up for these doomed co-ops and did nothing while they imploded is now penalizing folks who lost their coverage. This is ridiculous.
Despite the negatives, there are a few positives that come along with Obamacare. Today, more than 16 million people have obtained health insurance under the Affordable Care Act. Patients can no longer be denied coverage because of pre-existing medical issues. As a whole, Americans save $15 billion total on prescription drugs. There are no longer time limits for people with chronic health problems. Hopefully within the next few years, we can see this list of benefits grow.
Limit the amount families are forced to pay out of their own pockets. The insurance reforms rest on everybody having access to coverage.
President Trump wishes to repeal the Affordable Care Act. Trump plans to have a series of reforms ready for implementation. These reforms will follow free market principles and are made to restore our country economically. Trump is aiming to create sound public policy with his reforms that will keep the benefits of the ACA, such as more health care access and better quality and affordability of health care, while taking away the problems that came with Obamacare. Trump
plans to go completely through Congress with his reforms, unlike the president before him.
What we had before the Affordable Care Act, people hate it. Okay? They hate this worse than they hated that. Okay? And whatever President-elect Trump and the Congress does to change it, quickly the best they can do is get us back to where we were.
Must first repeal the ACA, then modify existing laws that inhibit sales of health insurance. Through tax returns, Americans must begin to become able to deduct health insurance premium payments. These Americans will then become able to use health savings accounts. Healthcare providers will be looked at more closely by the government, and price transparency will become required. Medicaid must be block granted to the states. And lastly, Congress must remove barriers to entry into free markets for drug providers that offer safe, reliable, and cheaper products. Along with many other changes Trump plans to implement, these reforms will help lower healthcare costs for all Americans.
Well, it's going to change. Okay? It doesn't matter. It wouldn't have mattered who won the election. It was going to change because it's failed. I tell people all the time, when you look at it, this is the definition of failure.
I believe the solution is to not repeal the act, but to improve it. The act has positive attributes, but it is more than obvious that there are issues, especially when it comes to cost. By making the act more affordable and not requiring premium payments from the insurance companies, we could see improvements. We also think by allowing the plans to compete over state lines to allow more choices could cause a positive impact. There is a long road ahead for the Affordable Care Act, but we have faith in the Trump administration to make a positive change.